the Spanish comparison is particularly interesting. When I go over there and say, by the way, our health system is 3 times the size of your whole country, and they're kind of like, well, how could that be? Their health care system is very different from ours. They spend about $1,200 per capita on health care in Spain versus about $6,300 per capita in the United States. And yet, when you look at the health outcomes, they have way better health outcomes than we do, spending 1/5 as much. They have a lower infant mortality rate. It's about half of ours. They've got a higher childhood immunization rate. They've got about a longer life expectancy by about 2 years, even though they smoke more. They've got about 20% less quality-adjusted life years lost to disease than we do, for 1/5 of the money. And when I went over there I was going over there to talk about digital medicine and trends in IT. A lot of the questions I got asked by the leadership of their health system were like, "What are you guys doing with all that money?" You know, and you ought to be real happy, you know, with the $6,500. People ought to be, you know, working together and all the rest of that. And I'm saying, you know, that's not the way it is. When you boil it down, the biggest difference between their health system and ours for that huge delta in spending is that in their health system, the surgeons, the radiologists, the cardiologists, the healthcare executives are all civil servants. They're well paid and they're well respected in their countries and communities, but they're civil servants. You know, they get sort of step increases every year. There aren't a lot of millionaires in the health system over there. And, you know, when you think about it, we actually have a little version of the Spanish health system inside the U.S. It's called the Veterans Administration, where the physicians are salaried and so are the healthcare executives, and they're on step increases. And by the way, you have to appropriate money every year to take care of them. And as you can see, the cost trend and per capita cost growth per beneficiary between the Veterans Administration and Medicare is really very different and has been widening over the last 25 years. Now, for extra credit, we're going to have a little quiz at the end of this talk. Spot the health system that has had a universal electronic health record for 8 years and also the best quality assurance program in the world. Okay, that's extra credit if you get a right answer to that one. The big difference between our health system and the health systems in most other countries is that in our health system, the major players, the major actors that are driving cost growth are free agents as opposed to salaried civil service type people. You think about baseball, and I'm an advocate of free agency. I like the idea that we pay for performance. I think that's a good idea. I want that surgeon that opens up my chest, or actually they don't open up your chest anymore to operate on your heart, they just go in through a little trocar, is motivated and focused. But in those free agent sports systems, basketball, baseball, they've solved the 2 Derricks problem, and we haven't. Now, what do I mean by the 2 Derricks? Well, there's different kinds of free agents, okay? There's Derek Jeter, who is a truly gifted athlete by anybody's measure, and then there's Derek Coleman, who those of you who are basketball fans remember was a huge waste of money for the New Jersey Nets and the Philadelphia 76ers and whoever the other unfortunate people were that inherited his contracts. In those sports, it's really important, and I'm actually not joking here, the mediocre performer ends up having to go play in Italy or doesn't get their contract renewed. And in our health system, because we don't want to hurt anybody's feelings, and that's really what it is, we pretend that everybody's Derek Jeter and pay him accordingly. We haven't figured out how to tell Derek Coleman, sorry, Derek, it's time to go sell insurance or automobiles or whatever it is, or go play in Brazil. We haven't figured out how to do that. And I think a lot of the money that we're paying for performance isn't really buying us free agent level play.